Medicare Advantage fails again. What they don't want you to know. Part 1. The promise that sounds too good. Have you ever seen those commercials on TV? A smiling retiree on a beach, holding hands, saying, "I got all my health care for $0 a month." That's the Medicare Advantage promise. $0 premiums, free dental, gym memberships, rides to your doctor. It sounds almost too good to be true. And for many people, it is. Today, we're going to talk about what really happens behind the scenes of some Medicare Advantage plans. Not because we want to scare you, but because you deserve the truth. And if even one person listening avoids a costly mistake because of this, then it's worth it. Let's start with Barbara. Barbara's 74, lives in Phoenix. Last year, she switched from original Medicare to an Advantage plan. She loved the idea of getting dental and vision bundled in. But when her doctor referred her to a cardiologist, she hit a wall. The cardiologist wasn't in-network. The plan denied the visit. She had to wait 5 weeks for an in-network provider, 40 miles away. Meanwhile, her chest pain didn't wait. Barbara's story isn't rare. In fact, more than 1 in 3 people on Medicare Advantage report delays, denials, or access problems every year. And yet, these plans are growing. Why? Because they're marketed brilliantly. But what's underneath the surface? Let's dig deeper.
Part 2. The denial system nobody talks about. Here's something most people don't know. Medicare Advantage plans can say no to your care. Unlike original Medicare, which is run by the government, Advantage plans are run by private insurance companies, and their job isn't just to cover care, it's to control costs. What does that mean for you? It means that when your doctor says you need this MRI, the insurance plan can say, "Hold on, not yet." They call it prior authorization. One man, David, waited 47 days for approval to get a scan after a stroke. By the time it was approved, he had permanent nerve damage. These delays aren't accidents. In 2023 alone, over 35 million prior authorization requests were made by Medicare Advantage enrollees. Of those, over 2 million were denied, and many patients never appealed. Not because they were wrong, but because they were tired, confused, discouraged. Have you ever been so frustrated with phone menus, call centers, or long forms that you just gave up? That's exactly what some plans count on.
Part 3. When free costs you more. Let's go back to that TV ad. The one that says, "All this for $0 a month." Technically, true. But what they don't say is that zero premium doesn't mean zero costs. Medicare Advantage plans come with copays, deductibles, and network restrictions. And if you get really sick, the costs can skyrocket. Original Medicare has no out-of-pocket max, but most people get a Medigap plan to cap expenses. Advantage plans have out-of-pocket limits, but they can go as high as $8,850 per year, or more in 2025. And remember, that's per year, per person. A woman named Ruth needed chemotherapy. Her plan covered it, but with 20% coinsurance. That meant thousands of dollars out of pocket. On a fixed income, it nearly broke her. She asked her plan, how can this be allowed?
The rep said, "It was in your handbook." But Ruth's eyesight wasn't great, and the handbook was 127 pages long. It's not just confusing, it's not just frustrating. It's unfair.
Part 4. Why so many people stay silent. By now you might be asking, if these plans are so risky, why do so many people sign up? The answer? Confusion, misinformation, and sometimes hope. For some, Medicare Advantage does work. If you're healthy, don't need many specialists, and stay in network, it might be fine. But here's the catch. You can't always predict your health. And the biggest trap? Switching back. Once you leave original Medicare and drop your Medigap plan, getting it back later might be impossible, unless your state guarantees it. One man tried to return after a cancer diagnosis and was denied a Medigap plan due to his health. He was stuck in the very plan that was denying his treatment. This isn't just about insurance. It's about choice, control, dignity. Part 5. So what can you do? This isn't about blame. It's about clarity. And now you have it. So if you're on Medicare Advantage now, ask questions. Call your plan. Look at your annual costs. Check if your doctors are still in network. Look for red flags like prior authorizations or coverage denials. If you're new to Medicare, learn before you enroll. Talk to someone not trying to sell you a plan. Call your state health insurance assistance program, or SHIP. Use Medicare.gov, not just TV ads. Review plans every year during open enrollment. And if this episode helped you, share it with someone who might be signing up soon. A friend, a parent, a neighbor. Because no one deserves to be misled. Not at this stage in life. Not after everything you've done to get here. Take care of yourself. Ask questions. And remember, you've earned better. If this conversation gave you clarity, please subscribe and leave a comment. Your voice might help someone else avoid a costly mistake. Until next time, stay informed, stay strong, and stay wise.